Have you ever wondered what happens when you undergo anesthesia? Who keeps the patient safe, comfortable, and asleep during the operation? In the United States, there are 3 types of anesthesia providers: anesthesiologist assistants, physician anesthesiologists, and Certified Registered Nurse Anesthetists, also called CRNAs. CRNAs are responsible for administering the majority of all anesthetics to patients. That's more than 50 million procedures each year. With more than 60,000 CRNAs practicing in all 50 states, you can find CRNAs inside hospitals, surgery centers, offices, and clinics providing anesthesia services for all surgical specialties. In many facilities, the CRNA practices independently. In fact, 80% of rural anesthesia is provided solely by CRNAs. From small sedation procedures such as colonoscopies to epidurals for patients in labor, and even big surgical cases on the heart and lungs, CRNAs provide all types of anesthesia services. It takes a minimum of 8 years of education and ICU work experience to prepare CRNAs to deliver anesthesia. This is because CRNAs must work in an ICU or similar critical care setting before enrolling into graduate school. All CRNAs graduate with their Doctorate in Nursing or Nursing Anesthesia Practice, and they must pass a national exam to become certified. All this training leads up to the CRNA's daily work of keeping patients safe and comfortable during a surgery or procedure. A CRNA will start their morning preparing the operating room and anesthesia equipment. This includes performing safety checks of the anesthesia machine, preparing airway devices such as a breathing tube, and drawing up anesthesia medications, including controlled substances such as anxiety, pain, and sedation medications. Next, the CRNA will meet their patient to review their past medical and surgical history, discuss the anesthesia plan, and obtain consent. In the operating room, the CRNA applies monitors to assess the patient's oxygen levels, heart rhythm, and blood pressure. A mask is applied to provide a 100% mixture of oxygen to the patient's lungs. Then the CRNA administers IV or inhalational medications to drift the patient off to sleep. Once the patient is asleep, the CRNA places a breathing device to provide the patient with oxygen and sleeping gas. The CRNA always stays with the patient throughout the surgery, keeping them safe and comfortable, adjusting their breathing, monitoring for signs of pain, giving medications, and continually assessing the patient's condition. When the surgery or procedure is almost done, the CRNA slowly starts to turn off the sleeping medications. When the patient is ready, the CRNA will take out the breathing device and bring the patient to the recovery room, where they hand off the patient to a recovery room nurse. The CRNA then goes back to the operating room and starts the entire process over again with the next patient. While it may seem complex, don't worry. CRNAs are specifically trained to provide anesthesia. This, combined with their nursing background, makes them the perfect person to monitor, treat, and advocate for patients when they are unable to do so themselves. So, the next time you or a loved one is about to have surgery, have comfort knowing that a Certified Registered Nurse Anesthetist, a CRNA, is watching and caring every minute of the way.